My name's Amina, and today I will tell you the purpose of our video. The purpose of our video is to illustrate an orthoptist in a clinical setting. In order to showcase a clear distinction in the specific abilities required for a professional consultation centered around patient care, we will provide two scenarios. Scenario 1 and 2 will entail the do's and don'ts of a consultation. Enjoy.
Did you want me to go grab the next patient?
Oh, that's okay.
Hello. Do you want me to sit down?
Yeah, you can take a seat there. Okay.
How are you today?
I'm good.
That's good.
For confirmation, please, what is your name?
Macbeth Foster.
And why are you here today, Beth?
Well, recently I haven't been reading the newspaper as clear as it used to be. I like reading my newspaper a lot. It's what helps me keep up with nowadays, but it's just not as clear. It's just getting all so small and fuzzy, and it's just very difficult.
So you're saying you have blurry vision?
I have blurry vision when I'm reading my newspaper.
Is it blurry vision or you just can't see out?
Wow. I know, I definitely see. I see things, they're there, but it's definitely blurry.
And do you wear glasses?
Oh well, I used to wear my glasses, but my dog chewed them up. Silly boy.
Okay. Don't share them.
Do you have a dog?
No, I don't. I'd love to get one though.
You
Can you
should get
focus
a
on
dog.
my eyes, please? Thank you. So can you not see, or what's hard to see?
Well, I said my newspaper is very blurry. Sometimes when I look into the distance as well, it's blurry, but it's mainly my newspaper. I like reading my
Speaking
newspaper.
about the distance, are you like reading it with like from close view, or are you just reading like?
No, well, I hold.
Further.
It's a very big newspaper. There's a lot of things in it, but I just can't see any of it.
Okay.
I can see. It's just blurry.
Okay. Thank you. Do you take any medication for your problem?
Well, I used to take medication for my skin because I used to have very bad skin problems.
Only about the eyes, please.
Oh, only about the eyes. Okay, well, no, I don't have any problems with the,
So no eye drops.
No eye drops. Oh, actually, yes, I do have eye drops, but my GP recommended them a very long time ago for my dry eyes.
How often do you take them?
I wasn't very good with them, but I did used to take them 3 days. He recommended me.
Okay. Any allergies?
Oh well, I do have dietary requirements of I'm lactose tolerant and
Okay. Again, just please the eyes.
Oh, sorry. No, not that I know of. I don't think I'm allergic to anything. It's just the lactose tolerant thing.
It'd be
It's
quite
very-
tough.
Yeah, it's
Can
very
we
tough
focus on
me.
the eyes, please?
Oh,
Who brought you here?
The clinical supervisor?
Okay. You can go now. It's okay. You can just go on
Okay.
lunch break.
Thank you.
oh,
It was nice
it
meeting
was
you.
nice meeting you too. She's lovely.
Okay.
How long has she been here before?
I've never seen that before.
She's never seen her.
Yeah. Any family history?
Oh, yes. My brother-in-law, he did have a condition.
Just immediate family, please.
Immediate family, relating to eyes or.
Yeah, relate to eyes.
Oh well, my dad did have something when he was, he recently he had something wrong with his right eye specifically. Then turned out to be both eyes.
Do you remember the name?
I think it was like generating the.
Macular degeneration?
Yeah, it sounds something like that. I'm not too sure if I have to be honest.
Okay, that should be all good.
One eternity later.
So I like knitting as well. It's really lovely
That's good,
hobby.
that's good.
I do that with my friends on
That's
the
good.
weekend, but I want to be able to do those things. I can't see it though. I can't see.
You'll be okay. You don't have to worry.
I'll be okay.
Just go to the waiting room, please, and they should call your name out.
Oh, outside?
Yeah, outside.
So you may be wondering what went wrong. Well, let's dive in. During the beginning of the appointment, the orthoptist did not lead the way for the patient and sat down on his own without prompting the patient where to sit. The patient was left standing on their own and had to ask the clinician where to sit. This is not good orthoptist skills or professional at all. During the consultation, the orthoptist was also quite distracted on his laptop. He was taking notes, but he wasn't making any eye contact or keeping in any conversation with the patient. When he was asking questions and taking history, he was basically cutting off the patient during their answers. He was also answering the questions for them. While the patient was indulging in the conversation and answering his questions, he was also cutting them off when it didn't relate to the eyes. Now, when building rapport with a patient, you'd want them to feel comfortable. You'd want them to open up to you and feel like they're in a safe space to, tell them the medical history, basically. But there was no chance given during that appointment. The orthoptist was also checking off a list of questions. He wasn't really engaging with the patient or taking any interest in what they had to say about their personal life, their family history, what happened with her dad, or anything like that. The orthoptist excused the student orthoptist from the room and stopped their learning process. This is a good example of what should not happen during a consultation, either with a patient or with a student orthoptist. Next, we will be showing you of what should happen during consultation and how to build rapport and communicate effectively.
We are going to take history and examine the patient.
Okay, perfect.
All right. And do you have any question before that?
No, not right now.
Good. I'm going to grab the patient. I am Forward. I'm orthoptist working in this clinic. In this session, we have Alia, first year orthopedic student at Lato University. Is that okay?
That's perfectly fine. That's good.
Fantastic. And before asking the question, would you like to ask your name, date of birth, and your address, please?
Yes, my full name is Macbeth Foster, and my date of birth is the 18th of the 2nd, 1967.
Great. And your address, please?
Oh, my address is 18 George Way Street.
Fantastic. While you are checking, I'm taking some notes on the right.
That is okay.
Great. What brought you here today?
What brought me today is not recently, I would say maybe a month or two, I haven't been able to read my newspaper as well as I used to. I love reading my newspaper. I do it with my husband, but it's not clear anymore. It's just quite blurry. Even when I'm doing knitting or anything like that, it's very, very blurry.
I can imagine how disturbing it is.
It's very disturbing. I can't do most of my things with my friends and social activities, especially my husband. We like reading together, but it's just too blurry.
Okay.
Yeah.
So I understand that your main concern about this is that your reading and your social interaction with other people. Am I right?
Yes.
Good. And this blurring, when did you notice that?
Oh, I would say about a month or two ago. Yeah.
A month or two. And does it did it start gradually or it start suddenly?
Oh no, it wasn't sudden. It was very gradual. Like I remember it was just very clear, and then slowly I started adjusting and squinting, and then it just got to one point where I just too blurry.
Okay. And is it in one eye or both eyes?
I want to say it's in both eyes, but sometimes I close one eye, which is my right eye, and I start seeing better with my left eye. So I want to say the left eye is the better eye for me.
Okay. I will examine both of your eyes and
Okay.
we'll see what is going on.
Yeah.
And regarding this blur vision, have you noticed this is for distance or for near or for both?
It doesn't. I would say it's for both, but I read more than I do activities further away. So I would just say my main concern is my reading.
Your near sight.
Yeah.
Blurred vision or loss of vision is in part of your visual field, for example, in the center or peripheral visual, or doesn't matter?
Well, no, because when I look straight ahead, I would say it's blurry, but then, everywhere else is okay. It's just, as I'm moving with the words, it's just blurry.
And regarding the previous medical condition? Have you had any blood pressure, for example, diabetes?
No, not that I know
Have
of.
you had any problem in yours, such as cataract, glaucoma?
Not yet.
No,
Not yet.
no. Okay, very good, very good. Did you have been using any kind of reading glasses, correction glasses?
Oh well, I did used to have glasses about a few months ago, but my dog chewed them up.
Oh.
Unfortunately, you know, he's a good boy, but he did chew up my glasses.
What was the last time that you had your eye checked?
Oh, about a year and a half ago. Yeah, I am due for one.
Okay. Taking any kind of medication?
Medication wise, no, I don't.
Nothing like that. Okay. Do you have any allergies to any kind of medication?
Regarding the eyes, no allergies.
No allergies. About the family history, did you remember any kind of condition, medical condition runs in your family?
Oh, yeah, well, my dad did have something. Unfortunately, he has. I can't ask him nowadays, but he did have something in his eyes. I don't remember the name though. It was like generating.
Okay.
Not too sure. I think it was in his right eye, but it could be both eyes.
Okay.
I don't know.
That's fine. The information that you gave me, well, based on this information, let me summarize what you have told me. You have 2 months of blurred vision,
Yes.
mainly on your left eyes. Am I
Right eye.
Right eyes, yes, correct, good. And it's happened gradually, and it's not related to distance or near vision.
Mhm.
And it quite disturbed your daily life based on that you mentioned.
Yes.
And
That's okay.
Okay, Alia, what do you think about this condition? What do you want to do after this interview?
Okay, so we're just going to do some follow-up tests just so we have it on our record. It's just a few tests that include visual acuity, visual field, and pressures. So it shouldn't be too long,
Okay.
shouldn't be painful, anything like that.
Oh, that's good. Okay, that's good.
Thank you. Well, based on this history and the examination that we will do, we will make a few, think about a few differential diagnoses at the end. But I believe we need to refer you to an ophthalmologist for a further examination and history taking, and we will take from that. Okay?
Thank you.
You can stay in the waiting room.
Okay. Thank you.
So, what went well? Let's dive in. During the beginning of the consultation, the orthoptist led the way for the patient and prompted them to sit down. He also introduced himself and introduced the student orthoptist who was also present. He also gained consent from the patient to allow the orthoptist to remain during the consultation and whether they're comfortable with that or not. During the consultation, the orthoptist had very comprehensive and well thought out questions. He seemed more interested in what the patient had to say rather than checking off a list. He did not cut off the patient and allowed her to continue her statement, whether it was related to the question or not. This provided a sense of comfort and ability for the patient to open up during the consultation. He was also very empathetical and understanding of the patient's past. During the end of the consultation, he reiterates what the patient has told him and reconfirmed all the details to make sure he got everything correct. He also involved the student orthoptist in the conversation and allows her to inform the patient on what will happen next and the test that will take place. This consultation builds rapport and shows effective communication and professionalism. Thanks for watching our video. I hope we successfully portrayed the purpose of our video and showcased the do's and don'ts of what to do during a consultation.